General Principles of Pharmacology. Introduction. Most of the medical students know the word pharmacology. The word pharmacology is derived from the Greek word pharmakon, which means drug, and logia, which means a study. It can simply be defined as the study of drug within the living body. Does this definition clarify pharmacology? Certainly not. There remain a lot of questions to answer. What is meant by the drug? What is the historical background? Where does it come from? What are the roots of drug administration? How is a drug getting into circulation? What is the drug distributed? How does a drug act? How is the action of the drug terminated? What are the clinical uses of a drug? What are the adverse effects of a drug? And so on. While describing it in detail, pharmacology can be defined as a branch of science that includes history, source, physiochemical properties, dosage forms, routes of administration, absorption, distribution, mechanism of action, pharmacological effect, biotransformation, excretion, clinical uses, and adverse effects of the drug. Nowadays, pharmacology is considered as an integrated rather than a separate science. The techniques and knowledge of several disciplines such as physiology, biochemistry, and even mathematics have been incorporated to make the subject easier and well defined. The synthesis of a new drug in the laboratory is mainly based on knowledge on chemistry, mathematics as well as physics that have been applied to the understanding of pharmacokinetics of a drug. Pharmacology is becoming more and more molecular in its outlook. The knowledge of pharmacology is an essential element in medical practice and is the basis for the discovery of the new drug. What is a drug? Since the term has been already used in defining pharmacology, it is necessary to explain what is meant by the term. The word is derived from the French. A drug is a substance or product that is used or intended to be used to modify or explore the physiological system or pathological state for the benefit of the recipient. Now, it is time to change the concept of defining drugs that used to be small compounds derived first from natural sources, later from organic chemistry. Nowadays, several proteins mostly produced by molecular biological techniques have been added. Tomorrow we may see for the types of drugs, DNA in the form of a oligonucleotide and replacement of defective genes and cells to replace or regenerate defective tissues are the two most likely candidates. Drugs are simple ions, to a complex one. For example, iron is considered a drug that is used for the treatment of iron deficiency anemia. Even some peptides, insulin, captopril, oxytocin, somatostatin, growth hormone, cycloserine, and ACTH, and proteins, streptokinase, tissue plasminogen activator, interferons, erythropoietin, antibodies, and vaccines, are also considered as drugs. The benefit of the recipient man or other animals includes the diagnosis, prevention, control and cure of the disease. A single drug does not fulfill all the purposes. Barium sulfate, a radio-opaque substance, is usually used to fill the gastrointestinal tract so that the defects can be exposed for the X-ray. Barium sulfate is used for the diagnosis of disease. It has no role in the prevention or cure of a disease. Immunization is used for the prevention of disease. Diabetes mellitus is still not a permanently curable disease. Glibenclamide or insulin is used to control it. On the other hand, metronidazole is used for the treatment of amoebiasis with the purpose to cure the disease. The word drug is sometimes replaced by the term medicine. The term antihypertensive agent may be used instead of antihypertensive drug. Scope of pharmacology. The scope of pharmacology is rapidly expanding and provides a rational basis for the therapeutic use of drug. The branch first achieved Professor Echelonal status was the pharmacy. It is concerned with the preparation, compounding and dispensing of chemical agents for therapeutic uses. Nowadays a pharmacy graduate is no longer called upon to prepare or package drugs since this is done by the pharmaceutical company. Pharmacy includes pharmacognosy, pharmaceutical chemistry, and biopharmaceutics. Pharmacognosy. Pharmacognosy deals with the identification of botanical sources of the drug. Pharmaceutical chemistry deals with the synthesis of a new drug. The formulation of a drug influences the pharmacokinetics and pharmacodynamics behavior of the drug. Pharmacokinetics and pharmacodynamics. Pharmacokinetics and pharmacodynamics are the two important parameters necessary to understand the general principles of pharmacology. Any drug therapy can be failed if the pharmacokinetic, as well as pharmacodynamic parameters, are wrong. The words pharmacokinetics are derived from the Greek word pharmakon, means drug, and kinon means to move. When a person swallows a drug, it does not remain within the stomach. It will move through the intestine. If it is absorbable, then it will enter into the systemic circulation. Sometimes the whole amount of the drug is not absorbed. The amount that is not absorbable will not be excreted out in the feces. After absorption, the drug will not stay within the blood, whether it is distributed throughout the whole body or excreted out. The distribution of drug depends on the nature of that drug. Later the parent drug will be metabolized mainly in the liver to make the drug polar so that the metabolites will be excreted out by the kidneys. This will answer the question of what the body does to the drug. Pharmacokinetics is defined as the study of the rate process associated with the absorption, distribution, biotransformation and excretion of the drug. That is, quantitative drug and its metabolites concentration in the body fluid and excreta at any time from the moment of administration until elimination from the body is complete. The primary standard of pharmacokinetics study is based on the data obtained following intravenous administration. Since the entire dose administered is placed directly into the bloodstream following intravenous administration, the pharmacokinetic parameters obtained are unaffected by all the potential rate-limiting and metabolic factors associated with drug absorption. After obtaining the primary pharmacokinetic parameters, the drug addiction parameters following other routes of administration may be evaluated and defined to the intravenous standard. Pharmacodynamic means what the drug does to the body. For example, aspirin lowers the body temperature in case of fever. Atenolol reduces blood pressure. The blood sugar level is reduced by glibenclamide. That is, lowering body temperature, blood pressure and high blood sugar are all considered as drug effects. It is better to say pharmacological effect. Pharmacodynamics includes the mechanism of action and pharmacological effects. The knowledge of pharmacodynamics is essential for the selection of drugs. Now the question is, where and how are the effects produced? Aspirin acts on the thermoregulatory center present in the medulla to readjust it. Atenolol acts on the heart and blood vessels to reduce cardiac output and peripheral resistance. Glibenclamide acts on the beta cells of the islet of Langerhans of the pancreas to release insulin. Here, the thermoregulatory center, heart, blood vessels and beta cells of the islets of Langerhans are at the sites of drug action. Besides this, knowledge about pharmacogenetic would be helpful to know about the influence of genetic factors on the effects of some drugs. About 10% of American black males show hemolysis after administration of primaquine that is due to hereditary deficiency of glucose 6-phosphate dehydrogenase in the red blood cell. The scope of pharmacology has been extended by introducing biochemical pharmacology, clinical pharmacology, immunopharmacology and behavioral pharmacology. Biochemical pharmacology describes the action of biochemical processes within the cell. There is a gap between pharmacology as a basic and as clinical science. Clinical pharmacology integrates therapeutics with the basic principles of pharmacology, research methodology, and biostatistics. It evaluates the pharmacological effects of the drug, the preferred route of administration, and a set range in human by a clinical trial. Immunopharmacology deals with the immunological aspects of drug action, including the effects of a drug on immune response and the development of antibodies in response to the drug. Any drug that suppresses the immune system play important role in the organ transplantation procedure. Behavioral pharmacology refers to the study of how the drug affects the behavior of the patient. This includes the description of the changes in behavior produced by a drug, and exploration of the mechanism by which the drug produces the changes. Pharmacoeconomic is the study of the cost of medicine taken into account. Pharmacoepidemiology is the study of both the beneficial and the adverse effects of a drug on a large number of people. While describing a drug, it is a vital issue about pharmacoeconomics on rational use of drugs. Nowadays we are expecting a drug-free permanent solution for many types of disease.
It is based on gene therapy.
The drug works from the outside in. I must continuously re-administer if the disease is chronic. Contrarily, gene therapy works from the inside and should keep working indefinitely.
It will revolutionize medicine.
Pharmacological effect. Although we are always accustomed to the term pharmacological effect, it is necessary to know how will it be defined? The pharmacological effect may be defined as the physiological and/or biochemical changes in the body produced by the drug in therapeutic concentration. No drug has a single pharmacological effect. It usually produces several pharmacological effects. Pharmacological effects may be classified as desired or undesired effects used in the usual dose. For example, rifampicin is used for the treatment of tuberculosis. The desired effect of this drug is to kill the causative microorganism Mycobacterium tuberculosis so that one will be cured of tuberculosis. The therapeutic concentration of rifampicin also causes some undesirable effects that cannot be avoided. The undesired effect may be harmless, harmful or beneficial. For example, rifampicin alters the color of urine, feces, sweets to red-orange and it is harmless. The harmful effect produced by rifampicin is the development of jaundice as a result of liver damage. Promethazine is used for the treatment of allergy. The concentration at which it produces is the desired effect.
It also produces sleep that is a beneficial effect.
Treating hypertension with beta-adrenergic blocking drug relieve the patient from angina, a beneficial effect. A depressed person with irritable bowel syndrome may incidentally benefit from the anticholinergic adverse effect of a tricyclic antidepressant. An effective drug may be ineffective or toxic that depending on its concentration in plasma or at the site of action. For example, theophylline, a drug used for the treatment of bronchial asthma, is effective when its plasma concentration is less than 10 microgram per milliliter. The therapeutic effect is usually obtained at the plasma concentration of 10 to 20 microgram per milliliter. Above this concentration may cause toxic effects. In the case of digoxin, the therapeutic effect is unlikely if the plasma concentration is less than 1 nanomole per liter. The beneficial effect with a low risk of toxicity is obtained when the plasma concentration of digoxin is in between 1 and 3.8 nanomole per liter. However, the risk of toxicity is increased considerably when the concentration of digoxin is above 3.8 nanomole per liter. A barbiturate in low plasma concentration only produces sedation, but when the plasma concentration of the drug is increased, hypnosis develops. Coma or death may occur with a further increase in concentration. The concentration of the drug in plasma is seriously considered when the drug has a low therapeutic index. The therapeutic index is the ratio of median toxic dose to a median effective dose. If a drug has a median toxic dose of 100 mg and the median effective dose of 5 mg, then the therapeutic index is 100 by 5 equals 20. Now the question is, what do we mean by median toxic dose? It is the dose at which 50% of the test animal will show toxic effects. Like this, the median effective dose is the dose at which 50% of the animal show therapeutic effectiveness. Drugs like theophylline, digoxin have a low therapeutic index. On the contrary, antibiotics have a high therapeutic index. A drug with a high therapeutic index is considered a relatively safer drug. Prodrug. Some chemical substances do not produce any pharmacological effect until they are chemically altered within the body. Such chemical substances are called prodrugs. Examples of prodrugs are prednisolone, cyclophosphamide, phosphanotoin, levodopa, omeprazole, etc. The concept of prodrug was first coined when a red dye, Prontosil, was first found to be effective against microorganisms only in vivo, not in vitro. It was due to the conversion of Prontosil dye, in vivo, to sulfanilamide, the first sulfonamide. Prontosil dye is a prodrug. In some cases, why should we prefer to administer the inactive drug instead of its active metabolite? Is it a fashion? Definitely not.
It has some advantages.
The concept of prodrug has been successfully applied to facilitate absorption and distribution of drug with low lipid, water partition coefficient, b. increase the duration of action of a drug that is rapidly eliminated, c. overcoming the problem of patience for acceptance of a product, d. promote the site-specific delivery of the drug, and e. to reduce the adverse effects. Among them, improvement of absorption after oral administration is by far the most common. Pivampicillin, talampicillin, and vacampicillin are the prodrugs of ampicillin.